Hello everyone, and welcome to this audio podcast. This audio podcast is part of a Pathology Chronicle. This audio podcast is part of a Pheno Rage, and this audio podcast is part of a Storm Robotics production. Today's audio podcast is part of sort of an iteration of a publication from in around 2023, looking at leadership and transfusion practices. So where this work where publication was concerned, or is and was concerned, a broader understanding of renal health or kidney health in general population is required in order to ensure that the best use of blood products are provided to patients who have long-standing conditions, but at the same time, being a leader in the profession also requires scientists or healthcare scientists to demonstrate integrity and have those important constructive discussions with a multidisciplinary team or MDT colleagues making transfusion requests, so that they know when it is safe and not safe to potentially transfuse patients more now so because of the variability in blood components and laboratory requests surrounding them. There are some very there at the same time there are some very adept healthcare scientists and scientists who have acquired a lot of knowledge or have a lot of knowledge and understanding in sort of the main areas of laboratory medicine. However, 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 are firstly either not offered an opportunity to implement knowledge base, for example, unable to demonstrate leadership or quality, and or secondly, where senior colleagues and practice management, for example, experienced managers are not identifying leaders in areas of laboratory practice who demonstrate work ethic, going beyond standard operating procedures and apply evidence-based practices and linking research. And there is still a need to appreciate what further aspects of care are required for patients with long-standing conditions or chronic illnesses in the broader sense, and where it would be pertinent to highlight what specific practices would help transfusion care guidelines across specific areas of laboratory medicine. That draws this audio podcast to a close. This audio podcast is part of a Pathology Chronicle. This audio podcast is part of a Pheno Rage. This audio podcast is part of a Storm Robotics production.